welcome back to BRMC's Healthy Connections. Denise, you are the APRN, which is an Advanced Practical Registered Nurse?
Registered nurse.
What can an Advanced Practical Nurse do?
Well, in the state of Arkansas, an APRN can do most anything in the clinic setting, especially in the family practice setting. We do head-to-toe assessments, we do diagnostic procedures, we are capable of interpreting those, though sometimes we might ask for additional assistance. For example, if we were to do an x-ray in our clinic, as with any other general practitioner, we typically send those to the radiologist to have that read.
Right.
But we're capable of ordering and interpreting those, most diagnostic procedures, EKGs, lab work, things like that. We are able to treat most things in the outpatient setting. You know, APRNs in the state of Arkansas have a pretty wide open scope. It depends on where we are, which will delegate what we can and cannot
Sort of like
do.
if you're in a rural setting versus an urban setting in cities, they'll give you a little more latitude if you're in the rural setting to...
This is true, and as well as, you know, we have nurse practitioners who work in the hospital setting. Now, I wouldn't be comfortable in the hospital setting. That would take some time.
Different
and some
skill
additional
sets.
training.
Yeah.
Yes. And, you know, the folks who work in the hospital setting wouldn't necessarily be able to just slide into my role and do what I do.
Right.
Although it would be harder for me to transition to the hospital. Just, you know, in the emergency room, APRNs function a little bit differently than what I do in the clinic. So
You
we're
like
all
that
under a big scope.
one-on-one with folks and take some time with them, and
Yeah, I do.
And ER is a fast,
very fast,
fast.
Yeah. I used to enjoy that.
Yeah.
Not anymore.
Now it's
Right.
Yeah. So it sounds like you found the perfect niche. So you're over at Baxter Regional Family Clinic. Where is that located, Kathy?
We are on Medical Plaza Drive, and where that is if you're on the road going up to the hospital, you have to turn left onto Medical Plaza Drive, and there's a curve, and we are on the right-hand side.
And you
There's
go
a
past the
big
geese,
sign.
or
Yes.
whatever they are, swans or geese or something that are there. Okay. All right. All right. So we know where you are, and you're in, I know that Dr. Kroom and Lee are both primary care physicians that you're working under. Is that
Dr. Lee's primary care, I collaborate with him as well as with Dr. Kroom, who's internal medicine.
internal medicine? Okay, thank you for the clarification on
You're
that. So when someone comes in, then they can come in with any symptoms that they're presenting to you. I imagine, are you starting to see more flu symptoms already?
Not yet. It's not here yet.
A little early?
A little bit early. I think what people need to understand is that for the most part, let me back up.
Okay.
The most important thing I learned in nurse practitioner school, to this day, I think we all took one piece that was most important. The most important thing I learned is that I always have the right to ask for help. If I don't know something, or if I've reached my limits, I'm not too big or too proud to ask for help.
Great.
So, number one, people need to know that I can handle most things that they would present with to my clinic, but if not, I have Dr. Kroom and Dr. Lee, whom I collaborate with on a daily basis, multiple times a day, with different things. If that's not helpful, or if they're not sure what we should do with the patient, there are other specialties. I can do that. I can not only take care of them, but if I can't take care of them, I can get them to the people who can.
Perfect. And we can't ask for anything more than that. I mean, that's what patients want.
Right.
If you can't help us, who can? If it's out of your area of expertise, who's the expert? So that's wonderful to know.
Right.
Yeah, patients, that's what we all want when we walk through those doors. So, now, can you write prescriptions?
Sure.
Okay. All
Sure.
right.
Yeah, in the state of Arkansas, I can write prescriptions. The DEA regulates which ones we can and can't. Well, the DEA regulates which medications are certain schedules, and then the state actually regulates which ones nurse practitioners can write.
Right.
And that's going through some changes right now, but yes, absolutely can write prescriptions.
So I think what I was looking at, there's nothing to slow down the process. If patient walks through the door and they come to see you specifically, you're going to be able to take care of them.
Sure.
From start to finish.
Sure. And, you know, a little side note, our clinic functions differently than some of the other clinics in town as far as the nurse practitioner's role. In our clinic, I have several patients who are just my patients. They don't want to see a man, or they don't want to see a doctor for whatever reason. They want to see me.
They're most comfortable with you.
Yeah.
And I can see why. I mean, that's, a lot of
And
women
I can
like...
see why people wouldn't be. You know,
Yeah.
everyone clicks
Right.
with, you know, a certain type of person. So in our clinic, we do allow patients to see me and only me. Some clinics, that's not the case.
Got some openings? People could...
Sure.
Oh, good to know. How can they reach the office?
Well, they can call us directly and get our wonderful front-end staff at 425-6212.
Okay.
And they can schedule an appointment with Denise. We also are leaving open two same-day appointments per day. We are not a walk-in clinic, but we do have same-day appointments.
Which is great, because
Correct.
none of us know when we're... I think there was
Right.
a little bit of a stomach bug that was going around, or still is, and it hits real fast. And that would be one of those where you'd want a same day.
Exactly.
Really like to be seen today.
Yes,
Yeah.
exactly.
So-
So they can call us, then they can get a same-day appointment
That's
with Denise.
great. And that's, you said that's 2 days a week?
No, we
Or
have two appointments a day.
A day, okay, all right. Good to know. I'm thinking as far as, can you give us some information, because flu season is coming, can you give us some things for people to look for other than to is it too early to get their flu shot?
It's not too early. I guess that's a matter of opinion.
Yeah.
The flu shots are here in some places. I know at the Walmart clinic we had those for a couple of weeks. We're out again. In my opinion, it's a little bit early yet, because flu season oftentimes doesn't really hit our area until January and February. So if you were to get the vaccination at the end of September, it may not last
carry over
through the end of February.
So they're only good for what, 3 months, 4 months?
Something like that.
Yeah.
You know, we'll talk about this later on in the week, and I always dread the questions about flu. People, you know, talk
I'm
about...
so glad I asked you then today. Wow, we're right up to a great start.
People always say, well, I took it 1 year and I got sick from it. And so that's something we'll talk about on Thursday. But, you know, typically what you see is a dead virus, or at least partially dead virus. So the possibility or likelihood of getting illness from the medication or from the vaccination itself is a null point. That just doesn't really happen. Now, you may feel a little bit run down, maybe a little bit feverish. That's your body's natural immune system response to the injection itself. That's how you become immune to the flu. And again, it's not perfect. You know, it's always a guess of what flu we're going to have this year in this area. So it's a good educated guess, but nevertheless a guess.
Yeah, and I love the fact that you pointed that out, that oftentimes people are getting their flu shots way too early. And I know over at the hospital we've started only with patients, and employees, et cetera, will all be a little bit later and farther down the line. And we're in early October right now. So yeah, it's going to be a little bit later. But patients, while we've got them sort of as a captive audience, so we're making sure that our patients are inoculated. It gives them a little better chance, since their immune system is already compromised with whatever illness they have. So, which is great. I'm glad we're able to do that for our patients. But what would be maybe the best time to do that then, do you think? Should it be in late October, November?
Middle to late October.
Yeah.
Would be best, probably.
Yeah, because you're right. We don't really see it until probably January.
Right.
Yeah. And it's always just, what are we going to get? What's going to be out there this year? So hopefully it's just a mild year. I think we've scared everybody half to death with the Ebola, and
Let's don't go there.
yeah, okay, we're not going there today. All I want to say is the hospital is totally prepared. So, yeah. People don't always realize how much preparation is done year-round and training that is done year-round, whether anything's out there or not.
Right.
There's always constant training going on to make sure that we keep our population as safe as possible.
Right.
I'm going to jump over to, just happen to think about insurance. Do you take insurance over at Baxter Regional Family Clinic?
We do.
We do. We
Okay.
take a lot of insurance.
Okay.
The key thing to remember for the patients, though, is for them to check for their specific plan
Mhm.
and make sure that the provider that they want to see is actually covered under their plan, because there are literally hundreds of thousands of different plans
Yeah.
out there in the world. And even though we do take Blue Cross and some of the major providers, that doesn't mean that we're in network with every single plan
That they have. Okay.
Correct. So they just need to make that quick phone call, get
To their provider.
card. Well, no, they need to call the number on the back of their
Back
card.
of their card, okay.
And they will be able to ask them, is this provider in our network?
Okay.
And it's a very quick and easy process for them.
Good to know. So, ladies, we need to take a short break. We will be right back. Don't go away.